Hi everyone, my name is Taylor Long. I'm a Master's in Science Nursing, Family Nurse Practitioner student at Arkansas State University. And for Create AState, I have done a project on aspirin use for primary prevention of cardiovascular disease. Here is my Create AState poster presentation, which will be discussed in detail in the next following slides. Introduction and purpose. Cardiovascular diseases, or CVD, are the #1 cause of death globally, with more than 17.9 million people dying from CVD in 2016. In Arkansas, heart disease is the leading cause of death, while cerebrovascular disease, or stroke, is the 4th leading cause of death. CVD includes a group of disorders affecting the heart and blood vessels, which include coronary heart disease, cerebrovascular disease, peripheral arterial disease, rheumatic heart disease, congenital heart disease, and deep vein thrombosis or pulmonary embolism. Primary risk factors for CVD include an advanced age, male gender, race or ethnicity, hyperlipidemia, hypertension, diabetes, and tobacco abuse. Many evidence-based studies have shown the addition of a low-dose daily aspirin can help to decrease the risk of CVD events by 17% in patients who are considered at an elevated risk. The United States Preventive Service Task Force recommends that adults aged 50 to 59 who have a 10-year risk for cardiovascular disease that is greater than 10% take a low-dose daily aspirin for primary prevention of CVD if they are not at an increased risk for bleeding, have a life expectancy of at least 10 years, and are willing to take aspirin daily for at least 10 years. Despite this recommendation, studies have shown that the national average of adults taking low-dose aspirin daily for primary prevention of CVD is only 30%. Here are some images on statistics involving cardiovascular diseases as well as some risk factors. Objectives. The purpose of the study was to examine the percent of patients aged 50 to 59 at a rural Arkansas clinic taking a low dose or 81 milligram daily aspirin for primary prevention of cardiovascular disease in comparison to the national average of 30%. In determining this percentage of patients taking aspirin for primary prevention of CVD compared to the national average, providers will be able to see if their prescribing practices are at goal or if they need improvement compared with the rest of the nation. Methods. A retrospective chart review of 50 electronic medical records was completed at a rural family practice clinic in Arkansas. Information was collected and entered into the ASCVD Risk Estimator Plus to obtain a 10-year CVD risk. Information obtained included age, sex, race, blood pressure, last cholesterol level, history of diabetes, smoking status, and if the patient was on any antihypertensives. Mathematical calculations were then used to determine the percent of patients which had a greater than 10% 10-year CVD risk who had aspirin listed on their medication list. Population included males and females 50 to 59 years of age with a greater than 10% 10-year risk for CVD based on the ASCVD Risk Estimator Plus who have visited the clinic between January 1st and November 30th, 2019. Exclusions included those who had a known history of CVD, those who were younger than 50 or older than 59, and who had less than a 10% 10-year risk for CVD. Findings. The percentage of patients taking aspirin for primary prevention of CVD at a rural clinic in Arkansas was 26%. Discussion and action plan. Compared to the national average of 30%, the rural Arkansas clinic was 4% less in prescribing aspirin to patients with a greater than 10% 10-year risk for CVD. Limitations include an unknown risk for bleeding, as a higher bleeding risk is a contraindication for aspirin use, and the possibility of aspirin not being listed on their home medication list, as this can be purchased over the counter as well. Providers should be well educated on current recommendations to help reduce the risk of CVD, as it is the leading cause of death in the United States. However, aspirin is consistently underutilized. Most patients who are seen in the family practice setting have multiple risk factors that include obesity, diabetes, hypertension, and hyperlipidemia. More needs to be done to protect these patients. More than 70% of people with a 10-year CVD risk of greater than 10% were not on a daily low-dose aspirin as recommended by the United States Preventive Services Task Force and supported by the American Diabetes Association, American College of Chest Physicians, American Heart Association, and the American College of Cardiology. This shows that there's room for improvement for the rural family practice clinic in Arkansas, as well as the rest of the nation. Further education should be given to prescribers on the use of aspirin for primary prevention of CVD. Included is a reference list. I'd like to acknowledge Dr. Tammy Hawkins, clinical instructor, and Dr. Mark Foster, advisor.